So today we will be discussing about extrahepatic biliary system, EHBS. What is EHBS? It is extrahepatic biliary system. Now before going to the extrahepatic biliary system, okay, before going to the extrahepatic biliary system, there are a few points related to liver which you should know. That's why I've asked you, have you seen the specimen of liver or not? You have seen and you have studied the external features also, right? Now, what do you think? What are the surfaces, borders are there in the liver? One border and 5 surfaces are there, right? Now, if you see the liver from the anterior aspect and if you see the liver from the posterior aspect, what do you think? What will be the appearance? As you can see in the screen, okay? So, this particular diagram which you can see, okay, this particular diagram, this is the anterior view of the liver and this is the posterior view of the liver. Okay, in the posterior view of the liver, can you see this green color structure? Actually, it is not green. To make you understand, the color codes are given. Have you seen the green color structure? Yes. And from this green color structure, can you see something is coming out? Okay. So today we will be discussing about this particular area. Okay. Today we will be discussing about this particular area. Along with that, we will also see how the bile which is produced by hepatocytes in the liver going into the second part of the duodenum. Okay, and that is very important. So you have studied the surfaces, borders of the liver. Okay, you have studied the relations also. Now if I ask you what are some important functions of liver? First of all, it stores glycogen, right? Then the serum, lipid, protein, those are also secreted by liver. During intrauterine life, it is acting as erythropoietic organ during intrauterine life. Among them, another important function is there, that is the production of bile. Okay, another important function of the liver is production of bile. Okay, so approximately 800 ml to 1000 ml, okay, or approximately 1 liter of bile is produced by the liver every day in our body. Okay, so the bile which is produced in the liver, it has to come out. Okay, now when it is coming out, at that time 2 different pathways are there, or you can say 2 different parts are there from which it is coming out. Okay, now what is the function of the bile? Emulsification of the fat. Okay, as you know. So that is required, because if the emulsification of the fat is not taking place, then it will not get digested by the enzymes which are secreted by pancreas, and after that, if it is not get digested, it will not get absorbed in our body. Okay, so for that, emulsification is required, followed by the digestion and then absorption. That's why for emulsification, bile is required. Now, how the bile is produced? As I said, it is produced by hepatocytes, the cells which are present in the liver. Okay, those are producing the bile. Once it is produced, after that it has to come out. Okay, what is the destination where it should reach? The bile which is produced by the liver, mainly by the hepatocytes, ultimately where it will reach? It will reach the second part of the duodenum. I don't think so you have studied duodenum till now. You will be studying the duodenum. Duodenum is the part of small intestine. Okay, 4 parts are there. In duodenum, 4 parts are there. Among them, if you see the second part of the duodenum, okay, on the posterior medial wall of the second part of the duodenum, 2 openings are there. One is major duodenal papilla and the one is minor duodenal papilla. Okay, so in the major duodenal papilla, this bile duct terminates along with the main pancreatic duct. Okay, so that is the area where the bile is draining or the bile is going. And after that, from the stomach, when the food will reach in that particular area, the emulsification will start. Okay, so that is the basis of this particular biliary system. Okay, now here I have mentioned EHBS, that means extrahepatic biliary system. Okay, what is the meaning of biliary system? Means the way a bile is carried out up to the second part of the duodenum, the pathway which is followed by the bile. Okay, now what is the meaning of extra? Now see, there are, as I say, 2 parts. Once the bile is produced from the liver and it is reaching up to the second part of the duodenum. In between these two areas, okay, two parts are there. One is intrahepatic part, another one is extrahepatic part. Intrahepatic part means starting from the cells, that is the hepatocytes, okay, up to the right and left hepatic duct, that is the intrahepatic part. Beyond that, there is the extrahepatic part. Intrahepatic part means the flow of the bile which is taking place inside the liver. That is called intrahepatic. Intra means inside the liver. Beyond that, the flow of the bile is called extrahepatic because it has came out from the liver. Okay. So today we will be discussing about the EHBS, that is the extrahepatic biliary system. Intrahepatic, few parts are microscopic, few parts are macroscopic. Okay. So intrahepatic part will be discussed during histo demonstration along with the histology of liver. Okay. Now in this diagram, as you can see, two diagrams are there. This is also liver, this is also liver. But what is the difference? This is anterior view and this is posterior view. Okay. Now there is a shortcut. Whenever you are studying the liver, there is a shortcut. In the spelling of liver, how many alphabets are there? 5. Okay. Please keep that in mind. Most of the things related to liver are 5. You can check after the class. Okay. In the liver, how many alphabets are there? 5 alphabets. Okay. So most of the, I am not telling everything, most of the things related to liver is 5. How many surfaces are there? What is the weight? 1.5. Okay. Like this, mostly it is related to liver is 5. Okay. So after the class, go and check. So this is the way, if you study, it will be easier for you. Okay. Next, this is the posterior view. Okay. In the posterior view, can anyone tell me what are the surface you can see over here? You can see two surfaces on the posterior view. Posterior surface and inferior surface. Okay. So this is the inferior surface and this is the posterior surface. Okay. In the inferior surface, you can see the gallbladder is present. Along with that, you can also see the cystic duct. This is the cystic duct and you can see the common bile duct. Okay. So some parts are seen, not entirely. Some parts of the extrahepatic biliary system can be seen in this particular view. Okay. Mainly in the inferior surface. Okay. So we are not going to discuss about the surfaces and all. This is just to show you that from where the extrahepatic biliary system starts. Okay. Next, about the surface, already you know, you have studied, right? Okay. Now here you can see the biliary apparatus. Okay. So together, intrahepatic, extrahepatic, together it is called as biliary apparatus. Okay. Now in the biliary apparatus, as you can see, the biliary or excretory apparatus of the liver, it includes the passage through which hepatic bile and gallbladder bile are conveyed into the second part of the duodenum. Okay. That means the bile which is secreted from the liver, it will go and store inside the gallbladder and then it is conveyed to the second part of the duodenum. That is the main function of the biliary apparatus. In doing that, it is divided into two parts. What are they? Intrahepatic and extrahepatic. So as you can see, the apparatus is subdivided into two parts, intrahepatic part and extrahepatic part. What is the meaning of intrahepatic? Inside the liver. Flow of bile inside the liver. This is the intrahepatic part. What is the extrahepatic part? Flow outside the liver up to the second part of the duodenum. That is the extrahepatic part. Okay. Now here you can see the flow chart. With the help of the flow chart, you can see how the bile is flowing. First, it is produced by hepatocytes. Okay. The bile is produced, then through bile canaliculi. After that, canals of Herring's are there, are also called as intrahepatic ductules. Next, you can see intralobar bile ducts are there. This is a part of triad, portal triad. Then right and left hepatic duct, they will join together to form common hepatic duct. Okay. So this right and left hepatic duct, okay, you know that mainly two lobes are there in the liver, right lobe and left lobe, divided by falciform ligament. Okay. So from right lobe and left lobe, two ducts are coming out. That is the right and left hepatic ducts. Okay. Once they are coming out, that part is the extrahepatic. Beyond that, this is the intrahepatic part. Okay. So up to this much, you can see that is the intralobular bile ducts. Up to this much is the intrahepatic. Beyond that, it is coming out from the liver, that is the extrahepatic part. Okay. So as you can see, right and left hepatic duct and common hepatic duct. Okay. So from right and left hepatic duct, the extrahepatic part starts. Now here also you can see the parts of the intrahepatic biliary system, that is the bile canaliculi, canals of Herring's, bile ductules, right and left hepatic ducts. Okay. Now this particular part we will discuss in detail during the histology class. Okay. Because mostly some parts are microscopic, so we will be discussing in the histology while studying about the histology of liver. Okay. So today we will be discussing more about the extrahepatic part. Now here you can see the intrahepatic part. Okay, for your understanding I have added this diagram. As you can see the flow, how it is coming out. Okay, and in each and every part, okay, each and every part, as you know, the canals or the ductules, whatever it is present, different cells will be there which will line those particular ductules, canals, canaliculi. Okay, so those are shown over here. Okay, so this particular part entirely it is intrahepatic. Okay, gradually you can see this is the right hepatic duct. From here it will come out from the liver. It is the left hepatic duct. It is coming out from the liver. So from this particular part the extrahepatic starts. Beyond that, this is the intrahepatic part which is situated inside the liver. Okay, situated inside the liver. Okay, next the extrahepatic biliary system. Okay, or also called as EHBS. Okay, in the short form it is called as EHBS. So in the exam, if question comes from extrahepatic biliary system, the short form is written EHBS. Don't get confused. Okay, in the question it may appear like this, write about the EHBS or applied importance of the EHBS, or other questions are also there. Okay, so EHBS means extrahepatic biliary system. Now the extrahepatic biliary system, what is the function? First of all, it will collect the bile from the liver, store into the gallbladder. Okay, from the liver cells, whatever biles are produced, it will collect it. Then it will store inside the gallbladder. Okay, and then it will transmit it into the second part of the duodenum whenever it is required. Okay, that means whenever you are eating meal in which fat is present, or fatty meal, when it goes to the duodenum, at that time only the bile which is present in the gallbladder will come out. Now for example, you are drinking water. Do you think bile will come out? No. Why? Because fat is not there in the water. Okay, so every time it is not coming out. Whenever it is required, that means whenever fatty meal is going into the second part of the duodenum, at that time only the bile will come out from the gallbladder. Now the question is, when it is produced from the liver, okay, after that why it is stored inside the gallbladder? From liver also it can go directly. For example, cholecystectomy is done, that means the removal of the gallbladder. Why it is stored inside the gallbladder? Any idea? You know that gallbladder is there and you have seen the gallbladder in the specimen of liver, right? Now, and you have also heard about cholecystectomy. During suppose gallstones are there, okay, multiple gallstones accumulated inside the gallbladder, in most of the cases it is removed. Okay, if it is removed, then why the bile is stored inside the gallbladder? Okay, think I will give you the answer, don't worry. So these are the parts of the extrahepatic biliary system. Okay, so in extrahepatic biliary system we are having the right and left hepatic ducts. From where they are coming out? From the two lobes of the liver, right lobe and left lobe, right duct and left hepatic duct coming out. Okay, they will join together to form one duct, that is called the common hepatic duct. Right, left, they will join together to form a common hepatic duct. As simple as that. Next, you can see the gallbladder is there. So just now I have shown you the gallbladder. So various parts are there of the gallbladder, and from the gallbladder a duct is coming out. What is the name of the duct? Cystic duct. Okay. Next, you can see cystic duct and then bile duct. Now the bile duct is also called the CBD, common bile duct. Okay, if you refer to some ultrasound report of the abdomen, where especially when the scan of the liver is done, at that time they used to check the patency of the bile duct. At that time in the report it is mentioned as CBD. They will not write bile duct. Okay, so these are the clinical terms which you should know from now itself. Okay, in the report you can see it is written as CBD, common bile duct. Okay, whether it is dilated, whether it is normal, so those things can be seen under ultrasound. So that time it is called as CBD. In book I have seen mostly it is written bile duct, but you can use CBD, common bile duct. Okay, so this cystic duct and the common hepatic duct, they will join together to form the common bile duct, and this common bile duct ultimately it will drain into the second part of the duodenum, that also posterior medial wall of the second part of the duodenum. Okay, and along with that some sphincters are there. Have you heard about this word sphincters? Can you give me example? Pyloric sphincter, very good, in the stomach. Okay, so sphincters are also there. 3 sets of sphincters are present. Now why sphincters are required over here? Because whenever the bile is flowing, the flow of the bile should be controlled. Now every time if the bile is passing continuously, okay, so that is not possible, because approximately 800 ml to 1 liter of bile is produced by the liver. That is the maximum capacity of the liver. Okay, so that's why whenever it is required, at that time only bile will go into the second part of the duodenum. So that flow of the bile has to be controlled, and that is done by the sphincters. 3 sets of sphincters are there, which is helping. Mainly one sphincter is there which is related to the common bile duct. Okay, other sphincters are also there, but they are not that important. Okay, now here you can see the diagram. So this is the diagram showing the extrahepatic biliary system. Okay, in this diagram you can see extrahepatic biliary system. Here liver is removed so that you can see the extrahepatic biliary system. So what you can see over here, so here you can see the extrahepatic biliary system. In the extrahepatic biliary system, first you can see 2 ducts are there, right and left hepatic duct. From where they are coming? From 2 lobes of the liver, right lobe and the left lobe of the liver. After that, can you see they are joining together to form the common hepatic duct. Okay? Now this common hepatic duct is joined by which duct? Cystic duct. So this is the gallbladder. Now from gallbladder you can see cystic duct is arising. It will join with the common hepatic duct at an acute angle. Once it is joined, then what is formed? CBD or common bile duct. You can see this is the common bile duct, or also called as bile duct. Okay. Now this common bile duct, you can see it is going downwards, and then where it is terminating? It is terminating at the second part of the duodenum. Now before termination, you can see it is joined by the main pancreatic duct. Can you see? So it is joined by the main pancreatic duct, and then it is forming a hepatopancreatic ampulla, or also called as ampulla of Vetter, and then it is draining into the second part of the duodenum, posterior medial wall of the second part of the duodenum. Okay, so this is how the flow of the bile is taking place. See, from the liver the bile is coming out. Okay, then it is stored inside the gallbladder. Now the question is, why it is stored in the gallbladder? Directly it can come, direct pathway is there. Now when the bile is stored inside the gallbladder concentrates the bile. From liver, the bile which is produced, it is not in concentrated form. When it is stored inside the gallbladder will concentrate the bile. It will absorb the water which is present in the bile to make it concentrated. Okay, so that's why the gallbladder is required, and then the concentrated bile is coming out. Okay, so whenever you are eating any fatty meal, for example butter or ghee, like this, these are fat containing meal. So whenever you are eating all those things, when it goes to the second part of the duodenum, at that time a substance, you can say hormone is released, and that is called as CCK or cholecystectomy. That induces the contraction of the smooth muscle fibers present in the gallbladder. Okay, so once the gallbladder will contract, the bile which is present inside the gallbladder, the concentrated bile, it comes out. Okay, and then the sphincter released so that the bile can enter into the second part of the duodenum. That's why gallbladder is also important. Okay, means if gallbladder is not there, the functions can be done, but at that time the concentration of bile will not be there. Okay, so that's why gallbladder is also required. So next we will see all the parts one by one. First we will discuss about the right and left hepatic duct. This diagram, this is a simple diagram, easy diagram. Okay, during the time of exam you can draw this diagram for extrahepatic biliary system. Okay. Now here you can see the right and left hepatic duct. Okay. Now this right and left hepatic ducts emerge as the porta hepatis. Okay. From the right and left lobe of the liver, the arrangement of the structures you can see. Now do you know what is porta hepatis, anyone? Yes, you have studied the liver, so you know porta hepatis. So, and you also know the structures present in the porta hepatis, right? So mainly you will see the right and left hepatic ducts at the porta hepatis. Okay, and along with this right and left hepatic duct, other structures are also there in the porta hepatis. That is the tributaries of the portal vein, main hepatic artery and hepatic ducts. Okay, these are the structures present in the porta hepatis, as you can see. Okay, see this one, left and this is right hepatic duct, they will join together to form the common hepatic duct. Okay, at the porta hepatis. Next is the common hepatic duct. So both the hepatic duct they join together to form the common hepatic duct, right? So the common hepatic duct it is formed at the right end of the porta hepatis. Okay, so the porta hepatis, at the right end of the porta hepatis, the common hepatic duct is formed by the union of both right and left hepatic duct. Okay, then onwards within the free margin of the lesser omentum. You have studied the stomach, so I hope you know what is lesser omentum. Lesser omentum is a peritoneal fold which is attached to the lesser curvature of the stomach. One end is attached to the lesser curvature, another one is attached to the porta hepatis of the liver. Okay, double layer fold of the peritoneum. This is the lesser omentum. So in the free margin of the lesser omentum, this common hepatic duct is going downwards. If you see the length is approximately 3 cm and diameter is approximately 4 mm. Okay, that is the dimension of the duct. Next, the relation. Okay, the relation is also important because this is not the only structure which is descending. Along with that, the other structures coming out from the porta hepatis is also descending along with the common hepatic duct. Okay, so relation posteriorly, if you see, portal vein will be there, and sometimes right branch of the hepatic artery, left side main hepatic artery, and below the cystic duct. So these are the structures which are accompanying the common hepatic duct. Okay, when it is going downwards. Now accessory hepatic ducts are also present, but not in each and every one. In 15% of the cases, accessory hepatic duct is also there. Now this accessory hepatic duct usually arises from the right lobe of the liver and terminate either in the gallbladder or into the common hepatic duct. Okay, so whenever you will be dissecting various bodies, at that time you can see the variation. Okay, that means every time whatever it is written in the book, you will not get the exact book picture in the cadaver. Variations are there. Okay, in various areas variations are there. Now in this diagram you can see the relation. Can you see the common hepatic duct? See, this is the right and this is the left. Okay, now this is the common hepatic duct. So see, it is descending like this, common hepatic duct. Now these are the structures situated posteriorly, these are the structures situated on the left side, these are the structures situated on the right side. Okay, so this diagram will help you to understand the relation of the common hepatic duct as well as the common bile duct also. Okay, because other structures are also present in that particular area. And what is the orientation of those structures, which is situated posteriorly, what is situated on either side, right side and left side, that you can see over here. Okay, now you can see this is the bile duct, the cystic duct is joining and then the bile duct is formed. You can see the bile duct how it is extending. Okay, and this is the duodenum. So this is the second part of the duodenum, and you can see it is draining into the second part of the duodenum. Next is the gallbladder. Okay, so I know you have seen the gallbladder along with the specimen of the liver. Okay, now what do you think where the gallbladder is situated? In the gallbladder fossa of the liver, which is present in the inferior surface of the liver. Okay, so the gallbladder is a pear-shaped hollow organ which acts as a reservoir of bile, not temporary, not permanent, temporary reservoir of bile, because whenever it is required, the bile comes out from the gallbladder. Okay, so it is acting as a reservoir of bile, hollow organ. Now it is situated in the fossa in the inferior surface of the right lobe of the liver. Already you have seen that. Okay. Now the fossa of the gallbladder, it is extending from the right end of the porta hepatis to the inferior border of the liver. And if you see the body of the gallbladder, it is also extending beyond the inferior border of the liver. If you have noticed, I hope you have seen the inferior border of the liver. In the inferior border of the liver, the fundus of the gallbladder, okay, it is extending beyond the inferior border. Okay, next time whenever you go to the dissection hall, please see the specimen of the liver. Next dimensions, approximately 7 cm to 10 cm in long, width is approximately 3 cm, and 30 to 50 ml of bile is stored inside the gallbladder. Okay, and slate blue color. If you see the fresh gallbladder, it is slate blue color. Okay, in a cadaver some color changes are there, but if you see a fresh specimen, it is slate blue color. Okay. Now what are the parts of the gallbladder? You have seen the gallbladder, right? 7 to 10 centimeter long, 3 centimeter broad, and capacity is approximately 30 to 50. Now what are the parts of the gallbladder? Okay. Now the parts of the gallbladder, fundus is there. Okay. If you go from lateral to medial, okay, if you go from lateral to medial, the parts are fundus, body, and neck. Fundus, body, and neck, and the neck will continue as cystic duct. Okay. So mainly 3 parts are there, and from neck, which is narrowed and extending as cystic duct. So in this diagram, you can see the parts of the gallbladder. So see, this is the fundus of the gallbladder, then the body of the gallbladder, and then this is the neck of the gallbladder. Okay, from the neck of the gallbladder, you can see a constriction is there and it is extending. So this part almost look like an S shape because of the unique direction of the neck, extension of the neck. You can see the cystic duct. So these are the parts of the gallbladder. Okay. Now, can you see the location of the gallbladder? See, this is the location of the gallbladder. So which surface is this? Inferior surface. Okay. And see, this is the porta hepatis. So please keep that in mind. Actually, there is not a clear demarcation between the posterior and the inferior surface. You can see in the book, clear cut demarcation nahi hai. So what, how to understand? Please keep that in mind. The porta hepatis which is there, above the porta hepatis it will be the posterior surface, and below porta hepatis it will be the inferior surface. Okay, means clear cut demarcation is not there, but if you study like this, then it will be easier for you to understand. And as I said, the fundus of the gallbladder. Now, can you identify the parts over here? So what is this? This is the fundus, this is the body, this is the neck, and you can see neck is extending as cystic duct. Okay. Now, if you see the fundus of the gallbladder, it is extending beyond the inferior border of the liver. See, this is the inferior border of the liver. The fundus is extending beyond the inferior border of the liver. Okay. Now, why I am emphasizing more in this particular part? Because it is having a important clinical significance. It is having a important clinical significance. Now the fundus is the most lateral part of the gallbladder. Okay, most laterally it is present. Typically protrudes beyond the lower border of the or the inferior border of the liver. Okay, and may touch the anterior abdominal wall. Now, what is the important clinical significance? Now, a clinical landmark of the fundus of the gallbladder is at the level of 9th costal cartilage, tip of the 9th costal cartilage, at the intersection of lateral border of the right rectus abdominis and the costal margin. Okay, so the right rectus abdominis muscle, okay, the lateral border of the right rectus abdominis muscle and the right costal margin, and at the tip of the 9th costal cartilage, this particular fundus of the gallbladder can be felt. Okay. Now, when there is inflammation in the gallbladder, that particular area, if it is pressed, then patient will feel severe pain. That is the clinical significance. Means these are the bimanual examination by which the doctor can guess whether problem is there or not in the gallbladder before doing any investigation, before doing any scan or before doing other studies. Okay, enlarged gallbladder can be appreciated clinically at this point. Okay, so that is the clinical significance of the fundus of the gallbladder. Okay, because in that particular part it is only covered by the anterior abdominal wall. Okay, nothing is there. So that's why it can be felt when there is enlargement of the gallbladder or inflammation of the gallbladder. Okay. Now, mostly it is covered by peritoneum, the fundus. Anteriorly, it is related to the anterior abdominal wall, and posteriorly to the beginning of the transverse colon. Now, here you can see, this is the fundus of the gallbladder. So, you can see the outer border of the right rectus and tip of the ninth costal cartilage. Okay. So, at that place, the fundus of the gallbladder can be palpated, not normal, when it is inflamed, when it is enlarged at that time. Next, here you can see the relation. Okay, here you can see the relation. So this is the fundus, right? So just below it you can see the relation, that is the transverse colon. Okay, as you can see. And anteriorly what will present? Anteriorly, first of all, it is covered by peritoneum, and more anterior to that, anterior abdominal wall will be there. Now in this particular diagram, you can see the body of the gallbladder. Okay. Now here also you can see the relations. Okay, you can see anteriorly the liver will be present. Okay, and in this particular area you can see the first part of the duodenum, head of the pancreas, and some part of the transverse colon is also there. Okay, so this diagram will help you to understand about the relations mainly of the fundus and the body of the gallbladder. Okay, next is the body of the gallbladder. So beyond fundus, the extended part is the body of the gallbladder. Okay. Now, if you see the direction, it is directed upwards and backwards. The body of the gallbladder beyond fundus is directed upwards, backwards, and to the left. Now, upper surface of the body is non-peritoneal, and the lower surface are covered by peritoneum. Okay, so the upper part where it is situated in the fossa of the gallbladder, that is non-peritoneal. Okay, have you studied about the bare areas of the liver? What is the meaning of bare area? Where peritoneal folds are not present. So fossa for the gallbladder is also an area where peritoneum is absent. I hope you know that. Now relation. So above, as I said, the liver is there, separated from loose areolar tissue. Then occasionally the gallbladder is suspended from the liver by mesentery, occasionally, not all the time. Below transverse colon and the first part of the duodenum. Okay, and right side the right colic flexor, left side the pylorus of the stomach is present. Okay, so these are the various structures which are situated around the body of the gallbladder. Okay, as you can see in this particular diagram. Okay, next the neck of the gallbladder. So from the body, the neck starts. So the narrow upper end from the body, the narrow upper end is the neck of the gallbladder. Now it is situated near the porta hepatis. That also right part of the porta hepatis. It is forming S-shaped because it is extending anterosuperiorly and posterior inferiorly. So the neck, why it appears S-shaped? Because if you see the direction, first it will go anterosuperiorly and then posterior inferiorly. Okay, that's why it is forming a S-shaped structure. Beyond that, it is continuing as cystic duct. Beyond that, it is continuing as cystic duct. Okay. Now at the junction, there is a constriction which is present. Now superiorly, the neck is attached to the liver by a areolar tissue. Inferiorly, it is related to the first part of the duodenum. Okay. Now if you see the mucous membrane, especially folds, crescent-shaped folds are there inside the neck. It starts from the neck itself, and then it is extending up to the cystic duct. And that crescent-shaped fold which is present in the neck up to the cystic duct, these are called as valve of Heister. These are called as valve of Heister, which controls the flow of bile through the cystic duct. Okay. The mucous membrane of the neck is folded spirally to prevent the obstruction to the inflow or the outflow of the bile. Okay, that means the flow of the bile is controlled by those spirally shaped mucous membrane which are present inside the duct along with the neck of the gallbladder. As you can see, this is the neck, so you can see the spiral valves which are present over here. So it is started from the neck and then it is extending up to the cystic duct also. So this spiral shaped folds of mucous membrane which are there, these are called as valve of Heister. Okay. Now this mainly controls the flow of bile. when it is going in and when it is coming out from the gallbladder. Okay. Now near the neck, okay, near the neck region a dilatation is there. Near the neck region a dilatation is there, that is called as Hartmann's pouch. As you can see, the Hartmann's pouch is there. Now this is also having a important clinical significance. Whenever the gallstones are formed, okay, mostly they are lodged inside the Hartmann's pouch, okay, because the dilatation is there. So gallstones are mainly present in that particular area when the gallstone formation is there. Okay, so here you can see the cystic duct with spiral valve. So see, this is how the appearance. Okay, that means if you take the cystic duct, okay, and if you take an LS of the cystic duct, then this will be the appearance. Cystic duct is about 3 to 4 centimeter. It begins at the neck of the gallbladder and then it will run backwards, downwards to the left, and then it will end by joining the common hepatic duct at an acute angle to form the common bile duct. Okay, as you can see, ends by joining the common hepatic duct at an acute angle to form the common bile duct, or also called as CBD. So this is the common hepatic duct, and you can see this is the cystic duct. It is joining. Okay, so it will go downwards and backwards, and then it will join the common hepatic duct. Okay, at an acute angle to form the common bile duct. Now if you see the interior of the cystic duct, as you can see, the spiral valves are there, and these are also called as valve of Heister. Okay, the 5 to 12 crescent folds are there arranged spirally, and these are called as spiral valve of Heister. Why they are present? Because they control the flow of the bile. Okay, that's why they are present. Next, functions of the gallbladder. So why gallbladder is important? Already I told you one function, that is that it concentrates the bile. When the bile is stored inside the gallbladder, at that time what it will do? It will concentrate the bile approximately 10 times. Okay, by absorbing the water which is present. So you can see, first of all, storage of bile and release of the bile into the duodenum whenever it is required. That is also a function. Along with that, what it will do? It will absorb the water which is present in the bile, and it will make it concentrate, or it will concentrate the bile. Okay, when the gallbladder is inflamed, the concentration function becomes abnormal, and the bile salts alone are absorbed, leaving the cholesterol behind. Okay, and this is the way how the gallstones are formed. Next, regulates the pressure of the biliary system by appropriate dilatation or contraction. So a biliary pressure is there. That means the biliary, extrahepatic biliary system, inside that when the bile is flowing, a particular pressure is maintained. So that maintenance of the pressure is also done by the contraction and relaxation of the smooth muscles of gallbladder. Okay, because if the pressure increases, then there may be a rupture of the small ducts which are present in the extrahepatic biliary system. Okay, so that's why it is also maintained, and that is done by the gallbladder. Okay, so these are some important functions of the gallbladder. Next, the largest one, that is the common bile duct, also called as CBD. Okay, so if you see how it is formed, the common bile duct, by the union of cystic duct and common hepatic duct at an acute angle. Okay, and then the common bile duct or CBD is formed. Now it is approximately 7 to 8 centimeter in length, and diameter is 6 millimeter. Okay, that is the dimension of the duct. Now it is formed by the close end of the porta hepatis by the union of common hepatic duct and cystic duct. So both the ducts will join to form. Once it is formed, where it will go? It will go downwards. As you can see, at an acute angle, formation of the duct passes downwards, backwards, and slightly left. That also within the free margin of the lesser omentum. Downwards, backwards, that also towards the left in the free margin of the lesser omentum, in front of the epiploic foramen. Okay. Next, it descends behind the first part of the duodenum and lodges in a groove which is present at the pancreas, head of the pancreas, passes through the substance of the head, and then it will terminate into the second part of the duodenum. Okay. So in the posterior medial wall of the second part of the duodenum comes in contact with the main pancreatic duct. Okay, and then it will pierce the wall of the duodenum separately. Before termination, both the duct will join together to form the ampulla of Vetter or hepatopancreatic ampulla. Okay. Now, where it is present, the ampulla is there in the major duodenal papilla, 8 to 10 centimeter distal to the pylorus of the stomach. Okay. Now, here please concentrate in this diagram. Can you see the common bile duct? Can you see the common bile duct? So, see the cystic duct and the common hepatic duct joins to form the common bile duct. Now, common bile duct is going downwards, backwards and towards the left. When it is descending, it is present in the free margin of lesser omentum in front of the epiploic foramen. Okay. Next, it is when it is descending, it is going behind the first part of the duodenum. How many parts are there in the duodenum? 4 parts are there. So, this is the first part of the duodenum. So, you can see it is descending behind the first part of the duodenum. Okay. After that, here pancreas is present. So, it is going behind the head of the pancreas. Okay. It is going behind the head of the pancreas and then it is turning towards the second part of the duodenum. So, this is the second part of the duodenum. Now, when it is reaching the second part of the duodenum, okay, what it will do? It will pierce the wall of the duodenum and then it will reach the major duodenal papilla. When you will study the duodenum, at that time you will come to know that on the second part of the duodenum, 2 openings are there. That is the major duodenal papilla, minor duodenal papilla and then major duodenal papilla. Okay. In that major duodenal papilla, this common bile duct along with the main pancreatic duct, they will join together and then it will open in that particular area. And this major duodenal papilla is situated 8 to 10 centimeter from the pylorus of the stomach. The distance is 8 to 10 centimeter from the pylorus of the stomach. Okay. Now, before joining, as I said, before terminating, it is joined with the main pancreatic duct. As you can see, this is the main pancreatic duct. They will join together and then they will drain into the second part of the duodenum. Okay. So, like this, the bile which is coming, it will go and drain into the second part of the duodenum. Okay. So, let you know why it is required for emulsification of the fat. After that only the pancreatic enzyme. So, I know in 10th or 12th standard you have studied that pancreas is secreting pancreatic enzyme. Okay. Pancreatic enzyme also helps in digestion. So, this pancreatic enzyme, it also contains enzymes which can digest the fat. Before that, it has to be emulsified, means it has to be broken into smaller parts. Then only the pancreatic enzyme can act on that to digest the fat. If it is not done, then it will not get absorbed in the body. Okay. Now, here you can see the common bile duct. Can you see the common bile duct? Okay, so this is the common bile duct. Okay, and here you can see this is the main pancreatic duct. Okay, so from pancreas, 2 ducts are coming out, the main pancreatic duct and the accessory pancreatic duct. Okay, accessory pancreatic duct is opening into the minor duodenal papilla in the duodenum itself. Okay, so see, this is the second part of the duodenum. Now, when this structure is descending, the common bile duct, along with that the other structures are also present. Okay, so few structures are situated posterior to it, few structures are situated on the left side, few structures are situated on the right side, and those will form the relations of the common bile duct. Next, the common bile duct from the formation to the termination, 4 parts are there. Okay, so the common bile duct from the formation to the termination, it is divided into 4 parts, and those parts are related to the duodenum. Why? Because ultimately it is draining into the duodenum. Okay, so what are the parts? First part is the supraduodenum. Supra means above the duodenum. Which part of the duodenum? First part of the duodenum. Okay, Compare with the diagram. Compare with the diagram so that you can understand. Okay, because the relations are categorized based on the parts. The first is the supraduodenal, the part which is present above the first part of the duodenum. Retroduodenal means behind the duodenum. Which part of the duodenum? First part of the duodenum. Infraduodenal means below, that also first part of the duodenum. Okay, and then intraduodenal means, what is the meaning of intraduodenal? Inside the duodenum. It is not ending in directly. Inside the duodenum, oblique course is there. The common bile duct, okay, inside the duodenum, it is having an oblique course, okay, which is accompanied by the main pancreatic duct. Just near the termination, they are joining. Okay, so that is the intraduodenal part. Okay, so how many parts are there of the common bile duct? 4 parts are there. Okay, and all those parts are related to the duodenum, mainly first part of the duodenum. Okay, now you can see the relation. Okay, now in the relation, so supraduodenal part means which will be situated above the first part of the duodenum. Okay, so anteriorly the liver will be present, posteriorly portal vein and epiploic foramen, as you can see in the diagram. To the left, hepatic artery is there. As you can see, the hepatic artery is situated on the left side. Next, if you come to the retroduodenal, means behind the duodenum. Okay, anteriorly will be the first part. So retroduodenal means what? Behind the duodenum. So what will come anteriorly? First part of the duodenum. As simple as that. Next, posteriorly IVC will be there. As you can see, the IVC is there. To the left side, gastroduodenal artery. Okay. In infraduodenal part, anteriorly the groove or posterior surface of the head of the pancreas. So in this particular part, head of the pancreas will be there. Okay, so anteriorly the head of the pancreas will be there. Okay, that means if you see the common bile duct, before termination it is situated behind the head of the pancreas. Okay, so what will be its anterior relation? Head of the pancreas. A groove is there through which it is going and draining. Posteriorly again inferior vena cava, as you can see. Okay, so these are the relations of the various part of the common bile duct. Now one part is left, that is the intraduodenal part. That means the part of the bile duct which is inside the duodenum. That is the intraduodenal part. Now here also you can see the relation. This is a beautiful diagram where you can see the different structures which are going downwards. Some structures are ascending. Okay, and this is nothing but the lesser omentum. Okay, so I have mentioned that it is descending in the free margin of the lesser omentum. So here you can see this is the lesser omentum. Okay. Next, the intraduodenal part. Okay, so the course of the duct through the duodenal wall, that is the intraduodenal part, and it is oblique in nature. Within the wall, 2 ducts usually unite to form hepatopancreatic ampulla, also called as ampulla of Vetter. 2 duct means the common bile duct and the main pancreatic duct. Okay, so the constricted ampulla opens at the summit of major duodenal papilla, that also 8 to 10 centimeter to the pylorus of the stomach. Now the structure of the common bile duct, that means the duct which is there, if you take a TS of the duct, common bile duct, if you take the TS, if you have taken the TS of the common bile duct, if you see under microscope, then what you will see? Different layers will be there. In the histo class we have discussed. Mostly if you take the TS and if you see under microscope, layers will be there. Mucosa, submucosa, do you remember? So same thing, same pattern is also followed in the common bile duct. Just I am showing you the layers, details will be discussed in the histo class. So first of all, mucosa is there, projects into the lumen and form an appearance of cross bridges. Okay, that is the speciality. What is the lining epithelium? Simple columnar epithelium with few microvilli are present. Lamina propria, dense irregular connective tissue is there, which is supporting the epithelium and its basement membrane. Mucous glands are also found in the subepithelial connective tissue. Adventitia, loose connective tissue containing smooth muscle, blood vessels, nerves, etc. Okay, so these are the layers. So this is the innermost layer and this is the outermost layer. Like this, the layers are present. Okay. So, as I said, details will be discussed in the histo class. Don't worry. Next, in the parts, I have mentioned that sphincters are present. Do you remember? Function of those sphincters. they controls the flow of the bile through the extrahepatic biliary system. Three sets of sphincters are there, as you can see: sphincter choledochus, sphincter pancreaticus, and sphincter ampullae. Okay, these are the three sets of sphincters present in the extrahepatic biliary system. Very important. Here is the diagram. Now in this diagram you can see this is the common bile duct, this is the main pancreatic duct. Okay, so the sphincter which is present at the terminal part of the common bile duct, okay, this is the sphincter choledochus. Here it is sphincter pancreaticus, and they join together to form the hepatopancreatic ampulla or ampulla of Vetter. In that particular area, the sphincter which is present, that is called as sphincter Oddi, O-double-D-I. Okay, and here you can see the oblique coats of the common bile duct inside the duodenum, and that is called the intraduodenal part. That is called the intraduodenal part. Okay. And as I said, what are the functions of those sphincters? They will control the flow of the bile. So the terminal part of the bile duct surrounded by the ring of smooth muscles, that is called the sphincter choledochus. Okay, at the terminal part of the bile duct, the smooth muscle fibers, they get enlarged to form a sphincter, and that is called the sphincter choledochus. Okay. Next, normally the lower end of the bile duct is kept closed. As a result, the accumulation of the bile can take place inside the gallbladder. Okay, because if the sphincter is open, accumulation will not be able to take place inside the gallbladder. Continuously it will come out. Okay, so mostly it is kept closed, and the accumulation concentration is taking place inside the gallbladder. When it is required, the sphincter will get open so that the bile can come out from the gallbladder. Now, in order to bile which comes out from the gallbladder, there should be contraction of the smooth muscles of the gallbladder. Okay, followed by the relaxation of the sphincter. Then only the bile can flow. Okay, so this is a reflex mechanism, and it is mainly controlled, as I said, by the cholecystectomy, a hormone which is secreted by the duodenal mucosa when fatty meal reaches the duodenum. Okay. See, when the food enters the duodenum, especially the fatty meal, the sphincter opens, bile stored in the gallbladder poured into the duodenum. Okay. Now another sphincter is also there at the terminal part of the pancreatic duct, that is called the sphincter pancreaticus, and another sphincter around the hepatopancreatic ampulla, that is called sphincter ampullae, or also called as sphincter of Oddi, which I have shown you in the diagram. Now this is also important. The sphincter choledochus is the strongest of all the sphincters which are present. Okay. Now in between the meals, means whenever you are taking something and the time required for the food to reach the duodenum, the sphincter offers a resistance of 20 centimeter of water to the bile flow. That is the pressure which is maintained inside the extrahepatic biliary system. Now when the meal appears in the duodenum, the gallbladder contracts so that the ductal pressure rises to 25 centimeter of water. Okay, that means whenever the fatty meal will reach the duodenum, at that time what will happen? The cholecystectomy will secrete, and it will cause contraction of the gallbladder. As a result, what will happen? The bile, more bile which is present inside the gallbladder will come out into the system, extrahepatic system. As a result, the pressure inside the extrahepatic biliary system will increase up to the 25 centimeter of water. This is how the pressure is measured. As a result, what will happen? The sphincter resistance will falls, and eventually the sphincter will open and the bile will flow into the small intestine, that is into the duodenum. Okay, so this is how the pressure inside the biliary system is maintained, and for that the main role is played by the gallbladder. A contraction of the gallbladder is simulated by secretion of hormone cholecystectomy from the mucous membrane of the small intestine. Okay, that also when fatty meal is reaching that particular part. Okay, so here you can see the sphincters. So this is the sphincter choledochus, this is sphincter pancreaticus, and this is the sphincter ampullae. Okay. Okay, so up to this much is the extrahepatic biliary system. Now two parts are left, that is the blood supply, nerve supply of the extrahepatic biliary system. followed by the applied importance, where we have to discuss about the Calot's triangle. Okay. I hope you have seen the specimen of liver. In that, please try to identify the Calot's triangle. Just I will show the diagram and then we will end. See, this is the Calot's triangle. So the triangular area, okay, which is formed by the undersurface of the liver, mainly the lower border of the liver, inferior border. Apex is formed where the cystic duct and the common hepatic duct is joining. This particular area. This is the Calot's triangle. Okay, we will discuss in the next class in detail about the Calot's triangle. Okay, very important, because when the cholecystectomy is done, at that time the ligation of the cystic artery is very important, and the cystic artery, the course is variable, means in each and every person it is not same. Different variations are there of the cystic artery. Along with that, the variations are also there in the cystic duct. Okay, so to do the cholecystectomy safely, those variations should be known. Okay, so that's why the Calot's triangle is very important. Okay, so the, next time when you go to the dissection hall, please try to see this particular area, the Calot's triangle, the boundaries and the content. Content mainly you will be getting the cystic artery. Okay, cystic vein is also there, and some lymphatics are also present. Okay, so I hope it is clear about the extrahepatic biliary system. Okay, thank you.